Thank you very much for having me here today. It's really an honour to be talking to this group about this issue. Do I need a pointer or anything, or is that... No, we're all good? That's fine. So I just wanted to introduce myself a little to you. So I'm a breast biologist. I study the cells that interact in the breast that make it work. And I find the breast to be a really fascinating tissue. It's unique. It has this amazing ability to develop during pregnancy to produce copious amounts of milk to feed a newborn, which is a really amazing process. But the breast also is the most susceptible tissue in a woman's body to cancer. As I'm sure you're all aware, breast cancer is the most common type of cancer in women. So we really need to understand better why this is and what is it that causes women to have increased risk of breast cancer. And that is how I came to be interested in breast density. So my research is really around understanding what breast density is, what drives breast density, and what is its association with breast cancer. So I was very comfortable with this job. Looking down the microscope is where I'm most comfortable. But I went along to a breast density scientific conference last year in August. It was a small meeting, it was about 40 people, and we're talking about breast density from a scientific perspective. And a woman came up and talked, and I understand a few of you know Kylie Tenk. She got up and talked to us about the woman's perspective on breast density and how it hides cancers. And she pointed out that there really was nothing known in Australia, there was no information available in Australia about breast density for women. And this really motivated me and a group of other scientists that were at that conference to take on that role in educating women about breast density. So we ended up, we've done a lot of work raising public awareness about breast density and educating women. So all of that part of my work, you can blame Kylie for. So my talk today is going to be quite broad. It's going to cover a lot of different aspects of breast density, and I hope you do find it interesting and informative. We're going to talk about what is breast density, how it's measured, and how common is it. The association between breast density and cancer risk. I also want to talk about the masking effect of breast density and the patient advocates which are taking up breast density as a cause around the world and changing policies. I'm going to talk more about Australia and how breast density affects the screening programs in Australia, and finally talk about what women with high density can do to manage their screening. Okay, so breast density is the white and bright on a mammogram. It has nothing to do with how breasts look or feel. You can't touch breast density. A doctor's exam can't tell you whether you have high density or not. It's really about how the breast looks on a mammogram, and more technically speaking, we actually refer to breast density as mammographic density, because it really is about what's on the mammogram. But we call it breast density kind of as, it just sounds a bit better, it's easier to say. So women range from low density through to high density, from mostly fatty through to extremely dense. And this is really just about how much white and bright is on the mammogram. And the most established and commonly used way of categorising breast density is the BioRads scale, which was developed by the American College of Radiologists. So this is very subjective. It is determined by the radiologist. They simply look at the mammogram and they put them into one of these four categories. So mostly fatty, or A, is where there is very little in the way of white. It's mostly the dark areas. Scattered density, a little bit more white. Heterogeneously dense, you're starting to see the stronger areas of white and bright. And extremely dense is where you really have a very, across the whole breast, that very white and bright appearance. So radiologists will sometimes differ in their categorisation of breast density. Not so much at the extreme ends, they're fairly clear, but the middle areas can sometimes vary in how they're categorised by different radiologists on different days. Also, as the mammogram goes through the machine, there is autocorrect that occurs where different machines will try to do a sort of adjusting the contrast and the brightness like you would on a photograph to try and filter out some of that density, because of course the mammogram is trying to detect early breast cancer, it's not trying to detect the density. So with all of those differences that can occur on different machines, sometimes there will be women that will have varying density depending on what machine, what radiologist they see. So what actually is breast density when you get into the tissue? So it's quite difficult because here you have a two-dimensional X-ray going into that tissue to actually see, well, what is causing that white and bright? So if you look on the left, the sort of the structure of the breast, so we have the glands and the ducts that make and drain milk when a woman is lactating, and they are surrounded by a fatty, they're embedded within a sort of a fatty tissue. And it's really the amount of these cells that make and drain milk and the cells that surround them, called the stromal cells, versus how much fat is in the breast, which determines breast density. So at the top there is low density, where you can see the blue or almost purple, they're glands. They're surrounded by pink, which is stroma. That is what makes it white and bright on the mammogram. And then all around there you can see sort of little circles of white. They're the fat cells. So the more fat is in there, the lower the density, so they're mostly fatty. And then at the bottom there is the high density. You have the glands again in the purple or blue, and then the pink is that stroma. And it's often very striking that stroma is really very, very highly abundant in a highly dense breast. So there is no single agreed upon measure for breast density. The BI-RADS scale is the one which is most commonly used. It is subjective though, and I think everyone's in agreement that it does have its limitations. So there's been a lot of work to try and get a better, more quantitative way of measuring breast density. So there are semi-automated methods, like for example Cumulus, and that's an example here. So Cumulus takes that mammogram image and there's a user who then adjusts the threshold of that image, so sort of how white and how dark it's going to be, and then draws a line around or identifies the areas that are white and then puts it through a computer which will come out with a measurement. So it's semi-automated because it relies on the user to adjust the threshold, but then it measures it with a computer software. There's also fully automated equipment, software such as Volpara or Quantra, which take the raw data that comes straight off the mammography machine and analyses it to give a number. So most of my talk is going to really rely on the BI-RADS categories because that's where the majority of the research and the knowledge is. So how common are the categories of breast density? So it's about nearly 8% of women between the age of 40 and 74 have extremely dense breasts. This is data that's come from America. We don't actually have Australian data to tell us what percentage of breast density is in different categories. But breast density tends to be higher in younger women and declines slowly throughout life. So there is a higher frequency of extremely dense breasts in women of younger age, and this declines slowly over time. So this graph that I've put up here, so the y-axis is the 100%, so that's all women of a particular age. So let's say take the age of 45 to 49. The black bar there is the women that have extremely dense breasts. They make up about 12 or 13% of the population in that age group. And then there's a lot of women in that heterogeneously dense category. And then less in the scattered density and the mostly fatty. But then if you go across and have a look at, say, the 65 to 69 age group, it's really only 2 to 3% of women that have extremely dense breasts, and you're seeing more women come into that scattered density and mostly fatty area. So having children reduces breast density, and menopause also. As women go through menopause, their breast density often reduces a little bit. But generally, if a woman is extremely dense at an early age, she'll often, although it will decline with age, she will remain in the higher end of the categories compared to women of her age group. And the frequency of extremely dense breasts also decreases with body mass index. So the more fat a woman has as a composition of her body, then the more fat will also be in her breasts, and they will be more fatty. So the real interest in breast density started in the 1970s. So John Wolfe was interested for about 10 years before he published this paper in what he called parenchymal patterns on a mammogram. And this is what we now sort of commonly call breast density. So he was noticing that there was a lot of variation in women in what these patterns looked like in their breasts. And he published this paper in 1976, and this is the first claim that breast density is associated with an increased risk of cancer. And so his claim was, it is possible to predict with considerable accuracy which women will develop breast cancer, and equally important, those who are less likely to develop it, based solely on the parenchymal pattern as seen by mammography. That's a very big claim, and he believed that he had identified something that was really a precursor to breast cancer. Followed very rapidly after this was a 1977 paper by Egan and Mostella. And what they had found was that breast density masks cancers. So if there is a lot of white and bright on that mammogram, it's a lot harder to see a white cancer on there. And their study showed this quite clearly. Breast density masks breast cancer, so they claimed that John Wolfe's discovery was actually about finding women who already had breast cancer, but it was hidden in their dense breasts, and so it wasn't about increased risk, it was about breast cancers that were already there that they just weren't able to detect. So they claimed dense fibroglandular tissue delays detection of breast cancer by mammography. Apparent increase in cancer risk in such breasts is due to this delay in detection. So this really triggered a 30-year debate between different camps. What is it about breast density? Is it increasing risk of breast cancer, or is it just masking cancers? And this went back and forth for a very long time, and it's very difficult to dissect these two things. And these two issues, they're quite separate issues in the field, but they complicate each other all the time. And it's one of the issues that has made it very difficult to make progress on understanding what breast density is doing because of these two issues. Nonetheless, around 2006, 2007, there were a number of papers that came out that were quite big, high-impact papers that really showed once and for all that breast density is associated with an increased risk of breast cancer. And this is one of these papers, McCormack and Dos Santos Silva, and they did an analysis of over 40 smaller papers that had all studied the breast cancer risk, and they established that breast density really is associated with an increased risk. So in well-conducted studies, density is one of the strongest risk factors for breast cancer. Our study also refutes the suggestion that the association is an artefact of masking bias or that it is only present in a restricted age range. So this study showed that there was an increased risk which was independent of age and body mass index. So the increased risk that was being reported was a 4 to 6 times increased risk compared to women with low density with the same age and BMI. So this was comparing the low density group with the extremely high density group. So the two extremes of the scale. And remember when I showed the graph showing the different sort of frequencies of different types of density, most women actually sit somewhere in the middle in the scattered density or the heterogeneously dense. So this was comparing extremely dense with very low density. So it's not really giving an accurate indication of the increased risk above average. And that's really what women want to know. So although it's clearly an increased risk, how much of it is, or what is the strength of this as a risk factor? How much do we need to be concerned about this? And this has been ongoing studies now. Recent studies have sought to address this by comparing extremely dense to scattered density. So that's that level B, more common type of density. And in this particular study, published earlier this year, they found that the risk was less than double with extreme density, and that was similar to what was being associated with having a first-degree relative of breast cancer. So about 50% increased risk or 80% increased risk. So not the 4 to 6 times increased risk, but still an important risk factor. But this is one study, and this is still something that's emerging, and I think we don't really know for sure, and we can't pin down for sure what the risk really is just yet. But there is further work going on to try and improve the risk prediction. So we have the BI-RADS categories, which are not perfect already, they're very subjective. Are there better ways that we can measure breast density which give a better indicator of the risk associated with it? And there was a paper last year that was trying to refine the way of measuring breast density, using thresholds and looking at how bright and white the mammogram is. And they reported that they had found these hotspots. So very, very bright regions of breast density, which were better at predicting risk than just the BI-RADS categories. And they are claiming an increase in accuracy by 30%. But this is research that's going on. It's not in practice in the clinic. There's still a lot of work to do to really understand the association and measure the level of risk associated with high density. So breast density is determined by a whole heap of factors. One of them is genetic factors. So twin studies have shown that there is a genetic component to breast density, and women with are likely to be similar to in their breast density to their relatives. Ovarian hormones, estrogen and progesterone, also affect density, but it's more complicated than this. We know that women who take hormone replacement therapy have an increase in their breast density, which is quite clearly seen by radiologists on the mammogram. Tamoxifen treatment, which blocks estrogen action, reduces breast density. But it is more complicated than that. When you start to look deeper into the association with ovarian hormones, it gets more complicated. So estrogen and progesterone bind to receptors on the breast cells, and that's really what determines their action. There is no clear relationship between breast density and the expression of these receptors. Some studies have found that they have a positive association, others have found a negative association, some have found no association at all. So it's quite clearly more complicated than simply how much hormones are in a woman's body and how that's affecting the breast. Also, breast density does not appear to affect the tumour subtype. So all different types of breast cancer seem to be increased in women with extremely dense breasts. However, there is still a lot of research going on in this, and that might, new research might change that view. So the biological mechanisms that cause high mammographic density and the associated increased risk of breast cancer are not at this stage clear. So we've been interested in inflammation as a possible driver of breast density. We've found that a high density is associated with an increased abundance of inflammatory cells and proteins compared with low density breast tissue. We've also shown that if we can induce a chronic low level of inflammation within the breast in a mouse model, we can cause an increase in the density of the tissue and also an increase in their cancer risk, which suggests that inflammation can be a driver of breast density. And there are some studies that suggest that women who take anti-inflammatory drugs have reduced breast density. And so that's an association, it's not causative. These were retrospective studies. So we're really at the beginning of understanding how breast density is regulated and how it can be controlled. These are very early studies. We haven't established this, but more research is definitely needed in this area. And I think clearly my view as a biologist is that these things are never simple. There's always going to be lots of different factors that contribute to how a tissue operates and how it's structured. And we think that really there are lots of different mechanisms which are at play affecting a woman's breast density. Hormones, obviously, inflammation, we've talked about, and a number of others as well. And it's not to say that all of the factors that affect breast density are actually going to be associated with an increased risk. And I think it's important to consider that it's an association between breast density and risk. It's not necessarily causative. So what we really need to do is understand what are the causative factors that result in high density, which also result in increased breast cancer risk. So a woman with high density might not necessarily have an increased risk. It's really more about what's happening in that breast that is driving that density. So then, are extremely dense breasts normal? So there are a lot of women who have extremely dense breasts that don't get breast cancer. And I think that's really important to keep in mind when women say they have extremely dense breasts. It doesn't mean that they're going to get breast cancer. And at the moment, what the broad understanding of breast density is that all of the categories of density, according to BI-RADS, are normal, and they're not an indicator of an unhealthy breast. In the future, this may change as we get better at measuring breast density and quantifying it and associating it with risk. There may well be women that we can identify that are at extremely high risk of getting breast cancer. So, that's possibly going to change in the future. So, just to summarise that, we don't really know enough about the level of risk associated with different risk categories, with different BI-RADS categories, to really know what the real risk is associated with breast cancer, with density. So the really more pressing problem with high density is that it makes it harder for a cancer to be seen on a mammogram. So we have these 4 categories of breast density, and on the right here is a mammogram of a mostly fatty breast, so it's mostly black, and it has a white breast cancer there. Now, that breast cancer can be seen quite easily by the radiologist because it is against the background of a dark breast tissue. If this woman had extremely dense breasts, it would make it harder for a radiologist to detect the white cancer on that mammogram. So breast density affects the sensitivity of the mammogram. And if you look at the sensitivity of the mammogram, and that's the ability of this mammogram or the radiologist to read that mammogram and detect a breast cancer, it reduces with increasing density. So it's about nearly 100% sensitivity in the mostly fatty breast, and it's about 50 or 60% sensitivity in an extremely dense breast. So there are women who will have a mammogram who will have breast cancer missed. And this is what happened to Nancy Capello in the US. Nancy was having regular screening mammograms for a number of years. They always came back normal. 6 weeks after one of these normal mammograms, she was having a physical exam at her doctor's, and the doctor felt something that was a bit unusual and sent her for another mammogram, which again came back normal. But this time he also sent her for an ultrasound, and the ultrasound detected a breast cancer, and it was a progressed breast cancer with lymph node involvement. And she was really shocked that the mammogram kept coming back as normal, and no one had told her that the mammogram was not going to be as sensitive for her because of her dense breasts. And she became a patient advocate and spread awareness about breast density, and it was really the inspiration behind the first law around breast density notification in the US. And this came into law in Connecticut in 2009, the first state in the USA that legislated mandatory breast density notification. So for every mammogram that was done, the radiologist, by law, had to notify the breast density to the patient. Since then, a number of other states have followed suit, and it's been patient advocates which have driven this in every case. So there are now 31 states in the US who have mandatory breast density reporting laws. Nebraska became this 31st state about 2 weeks ago, and this brought in what's known as Sherry's Law. Sherry was one of the patient advocates who sadly passed away of metastatic breast cancer, wasn't able to see this law being passed. On the right here is the Iowa State Governor signing in Patty's Law earlier this year with patient advocates looking on. The notification laws vary between states, and there's a fair bit of confusion about what needs to be notified and what women make of this information and how well educated they are about what this actually means. And so there's very little behind the notification to really help women make decisions about what they're going to do with this information. Nonetheless, there are patient advocates in a number of different countries, including the UK and in Canada, who are also advocating for notification about breast density to women because they don't want other women to be affected by the lack of notification as they have been. And these women have all had breast cancers missed, and in a number of cases have progressed disease, which may have been avoided if they had known about their breast density. So what's happening here in Australia? So 30th of September 2016, there was a couple of position statements put out about breast density. One of them was from the Royal College of Radiologists. So this position statement, have a read of it online. It's a very easy to read document. It states that mammography has been the central tenet to the success of our national screening program at Breast Screen Australia, where the benefits of early detection are maximised and the potential harms are minimised. The Breast Screen Australia program has been found to reduce breast cancer mortality by around 21 to 28% for women in the age group of 50 to 69 years of age. And they recommend that at this time, mammography providers, including Breast Screen Australia, do not routinely provide women with information about breast density. On the same day, Breast Screen Australia also released a position statement. The Standing Committee on Screening recommends that until such time that more evidence is available on how breast density should be assessed and managed, Breast Screen Australia should not routinely record breast density or provide supplemental screening for women with dense breasts. Mammography remains the most effective screening test for asymptomatic women aged 50 to 74 for reducing deaths from breast cancer in a population-based screening program. Okay, so what does that mean? Why aren't we reporting breast density? So one of the big issues that they point out is that there are limitations in how to measure breast density consistently. And this comes back to this BI-RADS subjective scale. So different radiologists using different machines might give women a different score of their density, and they don't want to be reporting breast density to women that might affect what decisions those women make or how anxious or they might be about their breast cancer risk if they don't have really solid way of measuring breast density, that they can feel very confident that they're giving women the right information. Then there's also the issue of what to do with a woman with extremely dense breasts, how to manage screening in that woman. So there are other screening technologies. There's ultrasound and MRI, which can be used in addition, supplementary to a mammogram, which can improve detection of breast cancer in women with extremely dense breasts. Tomosynthesis is a 3D mammogram, which can detect more cancers, or is better at detecting cancers in dense breasts. But none of these technologies have been shown in randomised controlled trials to save lives. So Breast Screen Australia, it does not aim to find lots of breast cancers. The whole point of their program is to save women's lives, and they do that through early detection of breast cancer so that they can, if you identify breast cancer early, before it's progressed, it's easier to treat and the woman has a better outcome, potentially a better outcome. So they need to implement methods of detecting those breast cancers which have been shown to save lives, because they are publicly funded and they need to be able to justify where that money is going. There are also potential harms in additional screening. So those other methods, MRI, ultrasound, tomosynthesis, they might detect more breast cancers, but they also detect more of everything else. So they carry with them an increased risk of false positives. If a woman has a false positive, you have an invasive biopsy to look at what that is. So the fear is that if women have all of these supplementary screening tests, they're going to end up with a much higher rate of false positives, and that does harm to women as well as not detecting breast cancer. So it's very difficult to find the balance between detecting more cancers and not doing harm. So they are concerned that for women with dense breasts, receipt of breast density information could create undue anxiety. And on the flip side, if women have fatty breasts, it may convey a false sense of security. And so they believe at this time it's just simply not viable to be giving that information. But Breast Screen Australia do leave the door open for breast density notification in the future. And they do say in their position statement that Breast Screen Australia recognises that in the future, breast density may have a role in determining the frequency and method of an individual's breast screening. Now that's not the whole story though, because Breast Screen WA have been notifying women about their breast density for 10 years. So they send women with dense breasts an information sheet. You can look at it online, it's available if you want to have a look. Just Google Breast Screen WA, dense breasts. And this tells women, your breast x-rays show that your breast tissue is dense. This is normal. Please contact your GP to make an appointment to have a breast check. And they also provide a little bit of information for GPs who might be seeing patients that have been given this letter. Breast Screen WA is recommending to women with dense breasts that they see their GPs for regular breast examinations. The assessment, and they do point out, the assessment of breast density is not reliably reproducible, and additional screening techniques result in additional false positive examinations and increase the number of benign breast biopsies. So at this point, it's not really known what either women or GPs in WA make of this information. There is no solid guideline for how GPs can help women understand this information and guide them through decisions. And this is something that's really urgently needed. It's a very complex issue at the moment. And into all of this came our group, Informed. And we were at this conference in August last year, listened to Kylie's talk and decided that we would do something about the lack of information around breast density in Australia. And this was before the position statements had been released from the college and from Breast Screen Australia. So there really was absolutely nothing available, no information at all for women about breast density in Australia. So we formed a group, Informed, which stands for Information Forum on Mammographic Density, and we decided to do something about this. So we talked a lot about how we were going to start the ball rolling with raising awareness about breast density, and we realised that this information had the potential to cause a lot of fear and anxiety for women, this hidden factor in their breast that they don't know about that could be increasing their cancer risk and hiding cancers on their mammogram. And we didn't want to convey fear, and we also didn't want to drive women away from breast screen, because breast screen is really where women go for their screening to save lives, and we would be doing a huge disservice if we made women lose confidence in that service. So we talked about how we were going to take the lid off this issue and start talking about it without raising the fear. And what we decided on was the real message that we wanted was, let's start a conversation. And we believe that a conversation between health professionals, Breast Screen Australia, and most importantly women, is what we need to do to make progress on breast density in Australia. And that was what we did with our website, and welcome you to come and have a look at it. We're very proud of it. Informed.org.au, where we provide a lot of information about breast density, and we're really advocating for this conversation. We update this regularly. We have a research page where we put up new research as it comes in, and we have a layperson's description of that research as well, so that the public can keep informed about what's going on, because it is a rapidly changing field. And we launched this, so 4th of October last year was our launch date for all of this new information about breast density. We also wrote a piece in The Conversation. Women should be told about their breast density when they have a mammogram. And again, we are advocating we would like to see health professionals, researchers, radiologists, GPs and Breast Screen begin talking with women about the best way to measure and report breast density. And our public awareness campaign, again on the 4th of October, we put out a press release, and there were 6 of us talking across Australia in each of our states about breast density on this day. So the ball got rolling with an exclusive from News Corp. A journalist interviewed me to be released on the 4th of October, and the article, "Mammograms may not detect cancers in women with denser breast tissue." We had a number of consumer representatives or patients within this story. One of them was a woman from WA, Pip, who had been notified about her breast density, and the article included information about what she had chosen to do with this information. And there was also a woman, Sandra, who had had an early breast cancer detected through a mammogram, and she was able to speak really positively about finding breast cancers early and the importance of mammography. And we felt that the inclusion of these 2 women in the story really would hopefully allay some of the fears that women might have when they're reading this article. So what can women do? So at the moment there are no guidelines around breast density, and this is something that we really urgently need. But I thought I would include what we do know, just simply because there needs to be some information out there. So first and foremost, I would back up the Breast Screen Australia recommendation that mammography is the gold standard for breast cancer screening. And we encourage women to use the Breast Screen Australia service, which is free, to have their breasts checked. Whether or not they have high density breast tissue, it is still the only method which has been shown to save women's lives, which is the most important thing. However, women who want to know their breast density can find out. They can get a referral from their GP and go and see a private radiology provider and have a mammogram and ask that radiologist to tell them their breast density. So we encourage women to ask questions. And also, I recommend that if women are interested in finding out their breast density and asking lots of questions, it's probably best to go to one of the specialist breast centres, breast clinics. That's where they'll find the most well-informed radiologist to help them through their questions. A 3D mammogram, tomosynthesis, is available, and some private radiologists are already using that for women with dense breasts. There's also the supplementary screening methods, such as ultrasound and MRI, which can be used in addition to mammography, which have been shown to find more cancers in women with dense breasts. But it is important that women consider the costs, both the emotional and the financial costs of these screening, and that there is an increased risk of false positive results associated with these technologies. And we do recommend to all women be breast aware. I know it's something that we talk about all the time, but all women, regardless of age, can be familiar with how their breasts look and feel and check them regularly, and if they do detect any changes, they should go and see their doctor. So I just wanted to summarise the take-home messages from this talk. So breast density is the white and bright that you see on a mammogram. It's not what you can feel, see or touch in your breasts. Almost 8% of women have extremely dense breasts, and high breast density is associated with an increased breast cancer risk, but more research is needed to determine the precise risk. And most women with extremely dense breasts do not develop breast cancer. Mammography is less effective at detecting breast cancer in women with extremely dense breasts, and whether or not to notify women about their breast density is a really complex issue. And at this time, Breast Screen Australia and the Royal College of Radiologists do not routinely report breast density. This is likely to change in the future as more information becomes available. And I did just want to finish by a shameless plug for our Facebook page, Be Informed, Know Your Breasts. This is where we post updates when when new research comes in or we have a new features article on our website. We share a link with it on our Facebook page. We also share links of the advocacy that's going on around the world as well. So it's a good place if you're interested in breast density and being up to date, finding out what's happening now. You're welcome to follow our page and keep updated. So thank you for your attention. I hope you found that information. So in the interim, so I'm hesitant to recommend anything because I think we really need to have the guidelines. There's a lot of information out there. It's always so complicated when you're trying to balance the risks and harms versus the benefits. So I think I fall short of recommending any particular pathway. Breast Screen WA do suggest that women have doctors' physical exams if they have dense breasts. I think it's sort of a halfway point, so it's not recommending supplementary screening but not doing nothing. Yeah. Yes. Well, I think simply because of the hiding tumours rather than the increased risk. And that's what Pip did. She took that letter to her GP and decided that she would have regular doctor's examinations. Her doctor did discuss with her supplementary screening and talked about the risks associated with that, and she decided for herself that what she was comfortable with doing. And I think this is really, that's what we want to come back to, is well educating women about what that density means and what options are available to them, and making it clear what those harms and benefits are so that they can make their own decision. Yes, so the GPs have a Red Book, which is their go-to evidence-based information to handle prevention, and it has a section on breast cancer screening, and it has nothing about breast density in it. So it's really something that we need. We need more information out there, and what I'm really advocating for is guidelines, national guidelines that in part will provide that information for GPs so that they can give women the most accurate evidence-based information to help them make their own decisions. Definitely. Yeah, I think we really, in the absence of really information coming through the correct channels, such as the NHMRC or Cancer Australia, there then proliferates misinformation. If you want people to get the right information, you've got to be the one to tell them, not let it come out through some other channel. And so, yeah, I agree. We need more to be coming down from the top. No, so there's really no difference in how a diagnostic and a screening mammogram is done. It's really what the purpose is for it. And I probably should have said in the talk that if a woman goes to have a mammogram and she has a symptom, breast density isn't going to be such a problem because the radiologist isn't going to let her go home, saying, yep, you're fine. They're going to do other tests to see what's causing that symptom. So it's a problem for asymptomatic women who, they're healthy women. They have no reason to believe that they have breast cancer. And that's where the issue is, because then you can be introducing potential harms. Breast density is the white and bright on a mammogram. You can't see, feel or touch your breast density. You can't tell your breast density from having a doctor's physical examination. You need to have a mammogram to find out your breast density. It's important because it is associated with an increased risk of breast cancer, and it also hides cancers on a mammogram. So a cancer appears as white on a mammogram, and when women have extremely dense breasts, that makes it very hard for a radiologist to see a potential cancer within that tissue. At the moment, we don't have guidelines around breast density reporting. There have been a couple of position statements put out last year from the Royal College of Radiology and Breast Screen Australia, which recommend not to notify women about their breast density. And this is primarily because the scoring of breast density is very subjective at the moment, and it really depends on the radiologist and the type of machine that the mammogram is done on, what that score could be, and it could vary from day to day or radiologist to radiologist. And there's also a lack of information about what women should do with that information. So if women receive a notification that they have extremely dense breasts, what next for their screening? There are a number of technologies which are available, such as tomosynthesis, which is a 3D mammogram, MRI and ultrasound can also be used, but these screening technologies have not been shown to help save women's lives. and they also come with an increased risk of a false positive. So there is the concern that notifying women about their breast density could potentially do more harm than good. However, breast cancers are being missed in women with extremely dense breasts. So it's really important that we are developing guidelines so that women can have breast density reported to them accurately and with guidance for GPs and other health professionals to help them make decisions about what they're going to do with that information. Informed is a national alliance of breast cancer researchers with 6 researchers across 4 different states and 5 different universities and institutes. And we're working at raising awareness about breast density, and our aim is to improve screening for breast cancer in Australia.